Okay, so the first point to note about systematic reviews, if you're not aware, is it is very much a team endeavour. You're not allowed to do a systematic review on your own because there are certain aspects of the research process that require team working. For example, double coding and checking and things like this. And so I'm just acknowledging here my main co-authors, so Ada Sonnenfeld, Jen Stevenson, Juliet Finetti, and Marie Garda. All of these people have contributed to this piece, and I hope I'm able to do it justice because, as you all imagine, as you will know when you work in a team, there are certain bits that you do yourself and there's certain bits that other people do. So I hope it isn't too obvious which bits I didn't do myself, but I'm happy to admit it later. We are gratefully acknowledging support from the United States Agency for International Development through an agreement with NORC at the University of Chicago. And our study is being registered with the Campbell Collaboration. So the peer review process is being managed by the Campbell Collaboration. And these are our expert advisors that we've involved in various parts of the review process. Okay, so for those of you that, this is maybe an unwise slide. For those of you that aren't able to stay for the whole time, these are the main findings. Okay, so what we've done in this study is focus on interventions that aim to promote citizen engagement in public service, participation or accountability. So it's involving citizens in some way in the governance of public services. And we've broadly articulated those types of interventions into those that operate through the short route, that is to connect citizens and service providers directly, and those interventions that operate through the long route. And the long route usually operates in a democracy through the electoral system, and in our study we are focusing on interventions which try to shorten the long route. So we're not covering voting interventions to improve voter registration or anything like that, but we are covering some long route programs. So an example of a short route intervention would be community report cards. So basically facilitating a community to evaluate in some way a public service and providing that information back to the service providers in order to improve some accountability and thenceforward public service delivery. And what we find for those types of interventions is that they are generally effective. They get you so far. So we find that they tend to be effective in improving service delivery itself, so access to services. But the further along the results chain, and you'll see what I mean by results chain as I go through the talk, towards final outcomes, we're less and less likely to see impacts of these types of governance interventions. And of course, there are some quite important reasons why that is. The second major finding is that interventions that aim to what we call shorten the long route, so they don't involve the voting system, but they aim to try to exert pressure by citizens to the very top of the system, so the politicians and the elected officials, and then get them to try to exert some pressure on improving service delivery. Those interventions alone don't tend to be effective. And then our findings around, so we have a couple of findings for which are probably more, those are our policy findings. Our findings for practice are more around things like the extent to which obviously we're working with service demand and service supply, and so obviously you can imagine that a circumstance where an intervention only targets one side but doesn't really do the work to involve the other side, you would expect those types of interventions to be less effective, and that's one of the hypotheses that's emerging from our study. So in other words, that the engagement with the service providers needs to be more sustained and direct. But second of all, something which we've actually tested in the study is that there seems to be a difference between services which are delivered by frontline staff and services which aren't. And as economists or social science researchers, that's broadly the difference between a merit good and a direct and a public good. Yes, thank you. But it's a merit good and a pure public good, and essentially where the services are actually delivered by frontline delivery staff, we're in a situation where citizens can actually exert that much more pressure and potentially change the quality of services. Okay, so that is broadly what we found in this study, and this is the second time that we're presenting it, and this is only the first time that we're presenting it to a publicly. So what was the motivation? I mentioned that this is commissioned policy research. So we were asked by USAID to do a synthesis study on what are called PETA interventions. That's participation, inclusion, transparency, and accountability. But of course, there is a huge amount of work which is going on at the moment and motivating this study. So I think the biggest one being those of you that saw the last year's World Development Report, for example. That there's a lot of focus not really on interventions, but actually getting the system right and the institutions, and and that hypothesis is that it's the institutions that matter rather than the particular interventions themselves. Of course, the Sustainable Development Goal 16 is all about this, and those of you that were aware of the Paris Declaration on Aid Effectiveness and that is driving kind of donor practice and governments. The other main, so that's the kind of policy rationale. What's the rationale for doing the systematic review? Well, the rationale for doing a systematic review is about what a systematic review aims to do, which is to try to articulate what findings are generalizable versus what findings are quite specific to context. And there are some very well-known studies, and I'll talk about some of them over the next 45 minutes or so, that find quite specific things in particular contexts. And so what we've tried to do here is to say, well, actually, are those findings replicable in different contexts? And if they're not, why? And if they are, why? And that's really what we're trying to do in systematic reviews. We're trying to establish this overall balance of evidence. Okay, so what is for the two of you that haven't come across systematic reviews before, what are they? So it's a scientific approach to collecting findings from existing studies. It's often referred to as a rigorous literature review or even just a literature review. A systematic review is not a literature review. A systematic review is much more like doing a primary study. So when you do a primary study, you will have research questions, you will come up with a pre-analysis plan to figure out how you're going to collect your data and how you're going to do the analysis. You will then collect the data, and it won't just be one person, it will be multiple people. There'll be a third person checking that, and so on and so forth. And then when you get your findings, you do the important knowledge translation work, which means that what you're finding is situated in a context which people that take decisions can actually do something with it. So that is very different from doing a literature review, which traditionally is a way for academics to communicate amongst themselves. So. But there, and if you have worked with systematic reviews, you'll be aware that there are concerns about that systematic reviews that only answer particular types of questions. Perhaps they only answer a what works question, and what we're trying to do is to go beyond bare bones in doing them. As my colleague Berta says. Okay, so what is 3IE's approach? We have done a rigorous and a relevant thing. That's what we try to do, rigor and relevance. So we do the top quality piece of work, which is as rigorous as it can possibly be, using the state-of-the-art methods, but we also make sure that we answer the right questions by drawing on the right types of evidence, which essentially boils down to answering questions about what works, how, why, for whom, and at what cost. Is that all the 3IE questions, I think? Pretty much all of them. Okay. I'm sorry that you can't see these slides, actually. So that says, at the top it says, what types of governance relationships do we cover? Okay, so there are kind of, this is actually from the, I think the original idea is from the WDR 2004. Okay, so that's kind of articulated that there are three main relationships that exist in the government sphere. The relationships between the state and the so the elected, or in a democracy, the elected officials, and the people and the service delivery bodies, so the service providers, and the relationship between the citizens and the state, which in a democracy again is as I've mentioned through the voting system. But then there's also a third relationship called the short route, which is that between citizens and providers themselves. So in education, that an example would be a PTA. Okay, we have explicitly excluded education programs because we see education as a particular sector which probably demands its own review, and then there is a systematic review already on some aspects of this topic in that sector. And so what we've included in our review are these interventions that operate through the short route, so they aim to get citizens and providers together in some way so that citizens can exert some kind, to change the power dynamic, okay, to get citizens to be able to exert some kind of power over providers in order to improve public service delivery. And we've also included some aspects of the relationship between the state and the citizens, but only those aspects which enable citizens to know, to have information about the performance of state officials, and it's only those types of intervention. And that's why we've called it shortening the long route. The third type of relationship, which is, my click is not working anymore. I think the battery's run out. Anyway, the third type of relationship, which is called the compact, is that between the state and the providers. So basically, any kinds of interventions that aim to improve how the civil service works, for example, or how the civil service relates to politicians. We're not including any of that type of intervention. Okay, so it's important to be aware that really the interventions on the supply that improve the workings of the supply side, we're not including in this review. That should be the subject of another review. When you do a review, it's a very rigorous study to do, and you have to cut out what you think is a manageable amount for a study. So we've focused on the demand side, and so the community citizen engagement approaches, and specifically. We've included or at least we've broken down our included studies into the following main types of intervention. So we have interventions which focus on engaging citizens in participation. So basically, the interventions which involve citizens in planning interventions. And so examples of that would be participatory budgeting, and here community-based natural resource management, which is actually quite a different intervention from the other types of interventions that I'm going to present, because it really involves partial or full devolution of both the planning but also the implementation side. And the other types of interventions are those which we've called those operating to improve accountability. So those are the kind of community scorecard interventions I've mentioned, but also two particular interventions which which operate to improve transparency. But it's transparency for accountability. The first one of which is providing information about rights. So if you let citizens know what are their entitlements regarding public services, then and there are quite a few examples of those that I'll talk about. And the last one is the interventions that aim to provide information about performance of leadership. So most of these are interventions that operate through the short route, and this performance information one is the one that operates through the long route. Okay? So what are some examples of particular interventions? So I'm trying to give examples of interventions that have been implemented in India. The first one is supposed. This is actually I've just Googled some Narega in Bihar. So these are some Narega workers in Bihar. And the intervention itself, what it aimed to do was to provide information to potential participants, so villagers in rural Bihar, about what their entitlements were around Narega, that they were entitled to 100 days per household per year, that work was available whether they were men or women, and it tried to help people understand. The intervention was done through a video, like they created. What they say in the paper was a very professional, it was like a movie quality film that they created, and it told the story about a family who'd, for years, the husband had to migrate seasonally, but because of Narega, it turned out that actually there was work in the lean season, so he didn't have to migrate, and that was what was told in this video that was then promoted in the village, and the villagers were invited, both male and female potential Narega workers, as well as the village leadership and the Rozgar Savak, and the Narega recruiter. So that's an example of a rights information program, and you will find out a bit later on how effective that program was. So on the other side is a performance information. These are a couple of policemen in, I hope it's Rajasthan, that's what Google Scholar told me it was. So the performance information intervention involved placing a community member in a police station once a week for like half a day, and that community member was, I forget whether they were a volunteer or whether they were recompensed, but the purpose of the intervention was for the community member to get a sense of what the police were actually doing. Were they actually doing their jobs? Did they treat people that they picked up fairly? Did they treat people that were the victims of crime fairly, etc.? And then that community member would go back to the community to tell the other members, the other people, whether the police were doing their jobs or not. And that's why it's an example of a performance information. Yeah. But most of the performance information interventions relate to some publicly providing information about politicians' performance. Yeah. And so most of what I will talk about will be about the politician performance information. There are quite a few examples of community monitoring interventions, but they don't tend to be done in South Asia. So actually, this is actually an example of some participatory fieldwork that we did at 3IE a few years ago. But essentially, the interventions would include community scorecards, so this for facilitating communities to evaluate a body and then taking that to the service provider maybe coming up with an action plan on how that would be performed and then monitoring that action plan. So that would be an example. The final examples of included interventions is participatory planning. So participatory budgeting, it's more commonly it's movement that came out of Latin America, but also approaches like community-based natural resource management, so things like water user associations, decentralized forest management, essentially decentralized delivery and management of natural resources. Okay. Right. Okay, so if you do systematically, we use this acronym called PICO, Population Intervention Comparison Outcome. I'm sorry that there are so many acronyms, and they're actually quite confusing acronyms. This is the PICO for the PETA review. So just to be clear, what we've actually included in this review. So we've included any, when you do a systematic review, it's secondary research. So you systematically search for literature, whether that's literature published in journals or it's literature which is grey literature, so it's available on organisation websites. And you then you systematically apply these inclusion criteria to see what type of papers are eligible. So what is actually sensible to include into this body of research. So our populations were basically any paper that related to public service users in low and middle income countries. So it could be any low and middle income country. Our interventions are those which I've just described. Our comparison was a standard access to public service. So actually, this review really is about governance. It's not really about service delivery in the sense that in all of the included studies, the only difference between our intervention and our comparison groups is that the intervention group, they got public services, but with the added governance intervention. Whereas the comparison groups all just receive standard public services. So in this way, what we do in this review is to estimate what is the additional effect of governance on public service delivery, and that was quite difficult to apply because we actually had it frequently in papers. Though those of you that work in policy research will be aware that most papers aren't very clear about what the intervention is, let alone what the comparison conditions are, and so there's lots of learnings for reporting of primary research that came out of this, but we do think we managed to do it, but it was quite a complex process. And then finally, in terms of outcomes, an included study had to at least assess a access to services outcome. Yeah. So those papers that just looked at processes around governance, if they didn't tell us anything about public service delivery or well-being outcomes, we didn't include them, because what we're really interested in is whether doing this is not just effective in improving governance processes, but is actually effective in improving outcomes. These are our review questions. It's just important. So we've answered these: what works, what does it work, why, how, and at what cost, and so on. And we've done that by drawing on rigorous impact evaluations. So often we think of those as being randomized control trials, but we've gone way beyond randomized control trials. Essentially, the study needed to have some kind of comparison group. Yeah, that's what an impact evaluation is. But whether that was a different group or whether it was a time series, we've included those types of studies. But we've also included what we might call sibling studies. So basically studies that reported on the same interventions as our impact studies, but perhaps using broader methods like qualitative approaches, or perhaps they were descriptive programmatic documents. We've drawn on all of those documents and we've primarily done that to tease out the questions about mechanisms, and in order that we can understand what the interventions actually did. Okay, so This is a study search flow diagram. Generally in systematic reviews, it's not uncommon that you see thousands of records being screened. The important point to note is that the vast majority of those studies are completely irrelevant because we have to cast the net quite widely so that we don't miss anything. We don't want to have areas of exclusion. Of the 221 articles that we identified at full text that were relevant to our PICOs and our research questions, we've ended up including 51 studies, and that corresponds to 35 distinct interventions and an additional 36. I think that's wrong. I think it's 39 additional qualitative studies. So just to give a sense of the geographical coverage, I mentioned that it was all low and middle income countries, and there's, the majority of programs that are included in our study are in 5 studies in India. Yeah. So how does it actually break down in terms of the specific intervention areas? So these are the countries where we have some rights information. So mainly Asia, East and South Asia. These are the studies where we have the performance information. So I mentioned Brazil's participatory budgeting, but that's been replicated elsewhere. These are the contexts where for the more accountability types of interventions. As I mentioned, there aren't any in South Asia. There are a couple of studies in Afghanistan, but they don't tend to be evaluated according to what we would be able to include in our review in Asia. And these are the studies that cover participatory planning, so a bit more of a global reach. And finally, community-based natural resource management. Okay. Okay. So I just wanted to highlight, since this is a audience in India, I wanted to highlight which are the types of studies. I suspect some of you will know the policy research literature. So if you're wondering what particular impact evaluations are in this review, you can see that on the right-hand side of this slide. So we have, and I've highlighted the interventions which are in South Asia. So I've highlighted those there. Okay. Okay. So how have we actually taken this very complex heterogeneous project and tried to say something sensible with it? Okay, and we've done 2 things in this review. So the first thing is that we came up with, very early in the review process, with the results chain, and this results chain kind of articulates the process from the engagement with the intervention with the citizens right the way through to the possible hoped for improvements in their standards of living, in their quality of life. But it goes through all of these intermediate stages. And what we've tried to do is focus on, because of course these interventions, they work on the supply side, but also on the demand side, so demand for public services, but also on the supply side by trying to exert some kind of pressure on service delivery. And the causal chain kind of works thusly, and it is, it isn't exactly the same causal chain for each intervention, but we're trying to say something at the high level at the moment. Okay, so our causal chain covers our intermediate outcomes. So that is the extent to which citizens participate, for example, in a public meeting, and the extent to which they participate in a meaningful way by making their voices heard. But it also concerns, on the supply side, what the response is by the service provider. So whether that is to change the budgetary allocation, or to motivate the people working in the public service. Okay. Then we move to intermediate outcomes, and intermediate outcomes are really about behaviours. And so, but once again, we have our behaviours of both on our supply side. So that relates to, after, for example, staff being more motivated in a bureaucracy, does that actually then lead to better access to services? So is there either an improvement in physical access to services, or perhaps the quality of service provision has been increased? And then on the demand side, whether that is then, is there any take-up of that improved service access? So do people use the Anganwadi service, or visit the health clinic and get their immunisations and so on? Or do they participate in Narega when it's available? And then finally, our final outcomes, which are our kind of quality of life outcomes, on the one hand would relate to our health outcomes in health programs, so nutrition, morbidity, mortality. And then this final outcome, which we've called state-society relations, which really relates to, is kind of, we think of it as a measure of the sustainability of the institutions, because it relates to whether there's feelings of trust among the citizenry with service providers and so on. And so what we've done is we've collected outcomes at each of these stages, and then we've grouped them into sub-outcomes, which are then sensible, which relate to a particular construct. And that's what we've synthesized. And the synthesis approach we've used is meta-analysis. What I've shown you here is an example of a meta-analysis. So this is a forest plot. It's supposed to be animated, this slide, so I'm sorry it isn't. And also my pointer isn't working, so I'll have to just kind of get in front of the slide. But a meta-analysis, what it aims to show is that each one of these individual lines is a particular program which is implemented in a particular context. And what the forest plot aims to do is to kind of show transparently what the study shows in terms of its point estimate and its 95% confidence interval. And we interpret that in relation to this vertical line. And this vertical line basically tells us that it's centered. What we're measuring here is an effect size. So an effect size just tells us what the magnitude of the change in outcomes is. And anything to the right of this line, if we see findings to the right of this line, what that means is that the intervention has increased this particular outcome. And if it's to the left, it's reduced it. And if it's anywhere, if it's on this line, or if the confidence interval overlaps with the line, that means that we haven't found an effect of that particular intervention, okay, or that particular program. So the other thing, so what we do in meta-analysis is there's lots of reasons why individual studies aren't able to detect effects, and that relates to the power of that study. Yeah. So if a study, particularly a study that finds a small effect, usually they're not able to detect effects because they don't have a big enough sample. And what meta-analysis aims to do is to say, okay, so let's collect all of those studies, bring them all together, and what can we say with this much bigger sample? How much more power do we have? And that's what we get when we do our diamond. So our diamond is technically it's a inverse variance weighted random effects meta-analytic average and 95% confidence interval. But essentially what this means is that typically we would expect an effect of an intervention, of a PETA intervention on user engagement, so whether they actually whether they actively participate in a meeting, so in other words, actually make their voices heard, we'd expect that to be around an effect size of about 0.2 with a confidence interval that doesn't overlap with the vertical line, so therefore it's statistically significant. Okay. And underlying all of what I'm going to do later on is to basically, I'm just going to present a lot of forest plots with, I'm just going to present you with the diamonds, because otherwise I think it's a bit too much information to give you. But this is another example of a forest plot, but in this case, which is for the extent to which the intervention actually changed public spending. In this particular case, you can see that overall, you see all the individual studies are non-significant, and overall we have a diamond that is pretty much centered on the vertical line, so no effect on public spending. Okay, so these are our kind of summary findings, and what I'm going to do is I'm going to talk you through the causal chain. So I'll start with our intermediate outcomes. So those are our outcomes relating to user engagement and the outcomes relating to the response of of service providers. And essentially what we find is that broadly the citizen participation, citizen engagement interventions are quite effective in what we call promoting active citizenship. So in other words, they're actually getting at people, they're good at getting people to attend a meeting if that's an important part of it, and improving knowledge about services, and also getting active participation. So there is actually there is some quality in the participation, although we're not seeing much improvement in knowledge about processes. However, on the kind of provider side, what we're not seeing is, I mean, there are some effects which are kind of marginal, but our overall finding is, which we would expect, is that if you have an intervention that targets users of services without possibly the concomitant intervention on the supply side, that essentially we're not seeing significant effects. Yeah, so we're seeing effects on the demand side, but not the supply side. Okay, so what happens when we move further along the causal chain? So let's now look at intermediate outcomes. So these are our summary forest plots, and underneath each of these is a separate meta-analysis. But what do we find? In terms of improving service access and service use, interventions, they tend to be at this kind of high level effective in improving service access. So whether that is physical access to services, or whether it's some measure of the quality of the service, or whether it's the cost of service. And I should note that as a technical point, that basically we've inverted all of our outcomes so that they measure something positive. So, for example, we're not saying here that these interventions have increased cost of services, and that's a good thing. What we've done is we've made sure that all of our outcomes, if measures consistently to the right of the line as being something positive. So in this case, actually, they've reduced costs of services, but we've changed it so that it's more interpretable. But we're not seeing consistent improvements of service use. It depends a bit on the sector. So health sector, we're seeing some better improvements of citizen use of services, but in other sectors less so. Okay, what about well-being? So as we get to this part of the causal chain, there's fewer and fewer studies. But anyway, we've also we've articulated health outcomes relating to nutrition, mortality, morbidity, disease, and fertility, and there are also outcomes in other sectors, so studies that measure agricultural yields, household assets, crime, life satisfaction and social capital. And what do we find? Okay, so there are a few instances where we're actually seeing some improvements in quality of life. Yeah. So that's a good thing. Some programs in particular areas, and I will talk about why that might be shortly, are able to do this. But in most cases, it's very difficult to say, and that's probably because there simply aren't that many studies reporting these outcomes. At least that it's probably partly because of that. And this is actually we're showing the full forest plot this time for state-society relations. So these findings are, we're not seeing overall a significant effect, but why am I showing you this more kind of this detailed forest plot? Because what you can see as well is that actually there's quite a lot of heterogeneity in the underlying studies. Yeah. So there are some cases where apparently, and that this particular outcome is taxes paid. Yeah. So people paying taxes or commute, or we've also considered contributing to a natural resources fund as is like paying taxes. So we've put those outcomes together. But we do see you see in some cases there are studies where there are quite big effects on tax payments, and in other cases, there aren't any. Yep. So there is this underlying heterogeneity, and that's what I'm going to go on to talk about now, to try to how do we unpack that and tease out that in order to examine the findings. Okay. So you'll be delighted to see another forest plot. I won't present too many more forest plots, but what this forest plot is doing is rather than presenting studies for a particular outcome at a particular stage in the results chain, it presents the entire results chain for a particular intervention. Okay, so what we have here is our performance information interventions. So the India example is the police in Rajasthan, but most of these types of interventions involve monitoring performance of politicians or certainly very high-level decision makers. So here's our results chain. Yep, and so we have what we're showing is our intermediate outcomes are. Our immediate outcomes, so our user engagement and our service provider response, our intermediate outcomes, so service access and use of services, and our final outcomes, so well-being and state-society relations. And what, in this particular case, which is performance information, essentially we don't see any effects of these interventions yet. So there's actually some quite good reasons why we might not expect citizens to be able to influence politicians who are usually the subjects of these types of interventions. And I think our hypothesis is that perhaps the results chain is very long, is probably too long for a intervention that only provides performance information about politicians to be effective. Yeah. So here's a simplified results chain for performance information, and so we're kind of we go from how it's supposed to work is that the intervention increases citizens' knowledge, but also common knowledge of political, so in either politicians or government office performance. That puts pressure on those officers to improve, and that might lead to improvements in service delivery along the causal chain, but it's a very long causal chain, and in particular for the interventions that involve politicians, there's it only really works where there's some constituency competitiveness. So in other words, if the politician thinks that, and there are other factors, but if the politician thinks that, okay, so if I don't improve my performance, then I'll be voted out next time, so there's a threat to my job, then at least I can try to at least visibly look like I'm trying to improve performance. Yeah, but how does it actually? And then hopefully that would lead to improvements in services themselves. So what actually might happen? And so there's a particular study in Uganda that has looked at this, and essentially because of the particular constituencies where there was no competition, there weren't the incentives for the politician to actually take the information into account and do anything about it. But even when there is a competitive environment, because of all of the things that determine service delivery, it would still be potentially possible for a politician to claim plausibly that they tried, but they weren't able to affect changes. So you don't tend to see changes in outcomes because of these performance information programs. So what happens when we look at citizen feedback and monitoring, so community scorecards? So it's a bit of more of a positive case. And when we look at the community scorecards interventions, we actually we are seeing some changes in outcomes right the way along the causal chain, including changes in well-being. And so what might be actually going on here, and what has our qualitative synthesis work done to help us understand in what context that might be more likely. So again, we have our simplified results chain, which starts with some kind of intervention which aims to promote citizens engaging with monitoring of public service delivery. And what we found, or what our hypothesis, which we've tested in this review, is that there's it really depends on whether the service is being delivered directly by somebody that, a typical example being a health service where your doctor or your nurse or you actually interact with that person, versus indirect delivery, which is more typical for your pure public goods, like, for example, a road. Okay, so depending on if there's direct delivery of service, then the citizens are able to pressure the service provider to improve, and depending on the extent to which that there is a kind of facilitated process, so it's not just that there is some involvement of service providers in trying to perhaps come up with an action plan together, or to depending on the extent of engagement with the service providers, we would expect there to be improvements in quality of services at the end of the day. And what happens when there isn't when there is indirect delivery of service? Well, the problem is that as it says here, there's a weak social sanction threat. So in other words, it's very difficult for citizens themselves to exert any influence when they don't come into contact with the service provider. Yeah, and so the hypothesis is, and I'm not sure that this is something which we have systematic evidence for, but this is certainly why. For in these kind of situations, the recommendation is usually that there is community organisation is involved. So perhaps some kind of there would need to be a collective CBO type of or body which was involved, and then perhaps that might then be able to be sufficiently credible. Okay, so we've actually tested, so this notion about the pure public goods versus merit goods or goods delivered by frontline staff, we've actually tested this, and this is the forest plot. Why am I showing you another forest plot? Because this is general, what we think is systematic or generalizable evidence. We think this finding is fairly generalizable. That we actually find that you remember that when we looked at the outcomes that related to the responsiveness of service providers, and we didn't tend to find that there was any impact. Well, actually, when we differentiate between the pure public goods and merit and the goods delivered by frontline staff, the results suggest that there is actually a provider response, but where the goods are delivered, where the public service is something that is provided by frontline staff, like in a health centre. And these are the findings for service access. So, you know, for the in this particular case, for the pure public goods, basically we're not seeing any effects. So the interventions, these particular ones, so for these particular ones, we're not seeing effects, but we also see that from some other quite well-known studies. And this final slide, which I think we're almost we're almost there now. This is the information about rights. So providing information about rights, will we expect that systematically to improve outcomes? And so again, we have our simplified causal chain. And in this case, and this is in this particular case, whether the but this, I think this is really more applicable to other interventions, but we're using this as this intervention as an example to illustrate it. That basically, if you're providing rights information about services, then that you might expect that to improve service delivery and well-being outcomes if there's any excess capacity in the public service to actually provide that service. Yeah. So in this case, it relates to what we've call here the relative supply and demand for public service, and if there is spare capacity or there is some way that on the supply side, in response to this greater demand for public services, there's actually a way of fulfilling that demand, then we would expect to see improvements. But where it's not, then there will be some rationing of services, and so perhaps there won't be any improvements, or perhaps there will only be improvements for particular groups. Okay, so those are like the high-level findings and the findings for the particular interventions. What happens if we actually try to drill down for particular population groups? And so what we've looked at were those interventions interventions that actually incorporated into the intervention some mechanism to be inclusive, so some way to involve disadvantaged people. And we did find that 8 interventions tried to do that. So they might explicitly encourage or mandate women's participation in the intervention, for example, or they might encourage another group like lower caste groups. But there were also studies that were conducted amongst, and we've differentiated the studies in low-income countries from studies of marginalised communities in middle-income countries, partly because there aren't that many studies that do it, and they're quite diverse in terms of the types of outcomes. It's difficult to say, but I think our headline conclusion is that we don't actually see differential effects when a intervention makes an effort to be inclusive. So that's a good thing. So we might think that it's difficult to, be inclusive. It might be more costly, and we might expect that more inclusive interventions aren't effective. But at least from what our analysis doesn't suggest that's the case. So the equity analysis. Studies that are differentiating, for example, men and women or higher and lower caste, there's not there's not too many of them. We're not, so it's difficult to say anything systematic. There are very few studies that really have that reuse a methodology which can actually tell us. This was an intervention which aimed to improve participation in the Gram Sabha meetings and of the panchayat, and essentially that overall the study didn't find effects, but they had a long-term ethnographic component in that study, and what that was, amongst other things, was able to tease out was that they were actually the elite groups were in some ways sometimes able to completely kind of nullify the participatory nature of the intervention and discourage active participation by women. We're not. So we've done lots of testing, and essentially that those are kind of the main findings for inclusion and inclusivity and so what about quality of evidence? Generally, when you do a systematic review, you kind of only include certain types of evidence, but that itself isn't a quality assessment. Study quality relates to the way that a study is done and not just its design. And generally, we have a mix of maybe 60% of studies are randomized trials, another 40% of the impact evaluations are non-randomized studies, and generally we see fairly consistent problems in, well, first of all, good aspects about studies. So they use methods that really do try to resolve confounding and selection bias and so on. So factors which we know are important in determining whether a finding is a causal one versus it being a correlational one. And why does that matter? Because if a finding is correlational, then there isn't any policy relevance. If a finding is causal, on the other hand, that an intervention actually improves an outcome, then it's a policy relevant finding. Or if but generally, and this is very common in it will be rare for you to read a systematic review that didn't have this finding, that essentially there are problems, and a lot of the problems relate to how the studies are reported. So it's quite difficult for us to, in some instances, to actually say, well, actually, do we think this finding is trustworthy? Well, it's in some aspects, for some particular domains, for some particular areas, it's difficult for us to say that. What we did find is that we thought there were probably more opportunities to do rigorous non-randomized studies than are presently being taken, what are called natural experiments, and those are quite cost-effective studies to do because they're generally based on existing data, so you don't have to go out and collect new data. And there are some good examples of natural experiments, but we think there's probably a case for more of them. Okay, right. So, how much time do I have left? 5. Okay, that's very generous of you. So, what are our implications of the study? So, I've this is really going back to my first slide. That what we think is that when we take the bigger picture view, we think that citizen engagement interventions are usually effective. We say in promoting active citizenship and improving access to and quality of public services, and we think that's a fairly consistent finding across the studies. However, the further along the results chain one goes, and particularly when one gets to well-being outcomes and state-society relations, it just becomes more and more difficult to have an effect on outcomes, and that is a consistent finding, and that is a consistent finding from, for example, the conditional cash transfers literature tends to find that it's an intervention that targets one side, which is the service users, and that's what in our review we've explicitly focused on studies that look at interventions that work primarily with the citizens. So our conclusion is that it's very likely, if you want to see impacts on well-being, that you need to overcome bottlenecks on the supply side. So do something that an intervention that relates to improving supply chains, for example, or the inner workings of the civil service, but also possibly interventions on the demand side that enable people to enable service users to be able to take them up. And we also found that the citizen engagement interventions were less successful where they tried to operate through the long route, and particularly where they tried to put pressure on politicians to improve public services. And second of all, where they targeted, even if it was operating through the short route, where it targeted provision of a pure public good, for example, roads provision. So, what are the implications for practice? So the main finding was about buy-in and trying to get buy-in from service providers at the point of service delivery. Part of the issue was that there were particular areas where, for example, in the case of community-based natural resource management, which I haven't really focused on because there aren't any examples in India, or there are a few examples in South Asia, where there was a case where, without having the appropriate mechanisms, that there might actually be a risk that there could be negative effects for vulnerable groups. The studies themselves had suggested that that buy-in was strongest where implementers fostered phased collaborative engagement with supply-side actors. So basically, it wasn't seen as a confrontational approach, and it was facilitated, and it was over a longer period of time. And particularly, if there was strong support from the supply side, like in the case of participatory budgeting, then we would see stronger impacts along the causal chain. So our kind of second set of findings related to the civil society organisations, and in particular where there were situations where where it was difficult for individual citizens to exert pressure on service providers that working with the local local CSOs would be a way to might be an effective way to do that. I don't think that this isn't systematic evidence, because we don't have the studies to be able to test this, and it's important to note that. Okay, so finally, for research, all I want to say about this is that studies, most of the studies measure effects over a short time period. So this is, I think on average, it's about 3 years from intervention to outcomes. So we've seen that in some areas that they might be very long term, like the provider performance. But it's worth noting that getting impacts on well-being may be something which takes, is not just relates to interventions, but is also something that might take a longer period of time. We looked of all of these studies, we also collected evidence on cost effectiveness, and we were only able to find one study which actually did any systematic cost effectiveness analysis. Like 4 or 5 studies provided some information about the total cost of the intervention was this, but only one study, and it's a very early study. It's pretty much one of the earliest studies in this literature that actually presented the cost effectiveness analysis, and it wasn't even clear whether on the cost side they actually included the costs to the participants, and so it's very common for this to be the case, but it remains a major omission from the impact evaluation literature. And we had some findings for systematic synthesis research and systematic reviews. Most systematic reviews will look at a particular intervention. What we tried to do, because the topic area is about governance and relates to institutions, is that we've actually looked and we've tried to look at the institutions, which is why it's a much broader type of review, and so I'd be interested to hear whether those of you that have come today have what your thoughts are about what we've done, and whether it is in accordance with your findings, and to get your comments. So I think that's it. We have a database of systematic reviews. There's over 700 of them if you want to know what works. Google, enter your search terms in our systematic review database, and there will be a load of systematic reviews there. Thank you.
There are other researchers, Stuti Khemani at the World Bank, for instance, is one who very much focuses on the long route, right? And her point of view is that the true sustainable route towards better governance is political engagement and having a politician-citizen compact that works, right? And then that drives the compact between politicians and bureaucrats and finally shows up, right? And obviously the kind of interventions that you've studied will find it very difficult to show up that kind of route, because they're not intended at improving the politician-citizen compact in some sense. There are other studies, again, which say that performance management on the supply side, on the management side, right? For bureaucrats, proper goal setting, having data flows both ways, which help people identify where the breakdown in supply delivery is happening, and correct for that is very critical, right? Like Karthik Muralidharan, for instance, is one of these advocates. And I think, at least from my last 3, 4, 5 years of having looked at this question, it's very clear that there's no real silver bullet for governance out there, right? No one of these things can really achieve. All of these things have to come together in concert for the equilibrium to move from a fairly low-level equilibrium to a higher one. And in that sense, I think it's very useful for this study to come in and say, in this one piece of this large system, what are the things that tend to be more effective, and what do they tend to be more effective towards doing? Because that helps you manage your expectations, right? That if you have a citizen accountability piece, it can help you engage citizens, it can help you motivate supply providers perhaps to some extent, but it can't really give you, again, it's not that silver bullet. It can't give you these outcomes later on in the line. You need to supplement it with other things. And I think that's a very useful finding. I think one of the things that I've thought about citizen accountability, and this doesn't necessarily fit with either the paper or what I was saying before, is there are different ways in which you can go about doing citizen accountability kind of initiatives, right? And I wonder if you had the opportunity to try and control for that in the paper. Now, if I was just to think about it, right, like intervention design in some ways, you could think of accountability in this, or participation in some senses, for the actual service user and getting feedback from them. You could also think of a model, and this has been tried in India, where a few users have to form something like a Rogi Kalyan Samiti or a school management committee, right? And those few users are then providing a public good for every other user, in the sense of, okay, the 5 or 6 of us will help improve the service by participating in this service provision, and then everyone else benefits from that. And it's quite clear that the incentives don't line up there, right? And I think India's experience has been that, right? School management committees get formed, so to speak, but then attendance at these committees is very poor. Meetings of these committees are infrequent, if at all. And I think that's a sort of theoretical breakdown. And how would you sort of control for that in a systematic review, right? Like whether the intervention that your study is testing, does it even make sense, in the sense of, would you expect something like this to work? Or is it just that because it sort of fits under your broader umbrella of being a participatory or a citizen accountability kind of initiative, do you just sort of study it and then report alongside, right? So I wonder if you ever got the chance to do that kind of filtering for your study, whether the theoretical design just makes sense. Would you expect this study to work versus some other studies? One other thing I want to just point out, and this is a problem for systematic reviews and literature reviews in general, right, is this meta bias of publication. Right? Publication tends to happen where results are shown. Right? It's an academic incentive. You try and have an intervention which you can show a result in, and that's what sort of drives why it gets published. And when you try and pick out of published studies, okay, these are the studies that I'm going to look at, you're more likely to find results than not, I would think, right? And I'm not quite sure whether you showed me a list of biases, but I couldn't be sure if this was one of the things that you were able to sort of think about or control for. So that would be interesting to hear your take on. I think one of the stronger sort of things that have come out from your study, right, is this typology difference that you've taken, that if you have a frontline worker or a service provider that citizens are directly engaging with, that's one area where a citizen accountability or a social accountability kind of mechanism is more likely to work, right? And it sort of helps people who are in this to try and pick those areas to do these kind of interventions. So that's really, I think that's quite useful. And finally, I think in terms of how I think the study would be stronger, it's probably if you would have had what I mentioned in the earlier thing, right? Especially that police study, for instance, right? I mean, I heard you describe the study, and my immediate reaction to that was, but I don't expect that to work, right? Like, I don't think having one guy in a police station who sort of looks at, okay, how are police treating citizens, and then goes back and tries and tells other people to do it, I don't expect that would work. So it's taking away from your long route results in some sense, but I don't know if that's a valid reason to sort of do that. And yeah, pretty much it from me. Thank you.
Thanks.
Sorry. I was thinking we were going to open it up, but I need to respond. Okay. I think I'll start with the. Let me just.
Yeah. Here you go.
Nice.
This one.
Yeah. So I'll start with the. I'll start from the. I'll work from the reverse backwards. I think on the Banerjee study, I would completely agree that you. It doesn't sound like a very effective intervention, and I think it's worth noting that in that paper, it's a Banerjee and co-authors paper.
Yeah.
There are 4 interventions. So what they do, and it's a very nice paper because it shows the advantage of doing trials. So it's situated in the Rajasthan Police Force, and they test out 4 different interventions, only one of which was eligible for our review because it's the intervention which works on the only with the citizen engagement. And there are interventions that were more cohesive interventions that aim to improve governance, some of which were actually effective, and we might, as we would expect them to be. But I think it's worth noting that that evidence that this particular intervention wouldn't work, that is still useful evidence. I mean, although perhaps you personally wouldn't think it would be effective, but hindsight is always 2020, and it is worth testing things that we might. Even if we're not sure about, I mean, that's really why we do impact evaluations, I guess. So it's actually, that particular case, and that intervention wasn't effective. This community-based one. That's actually an example where authors have published null findings. So it's actually an example where the authors have tried to address problems of publication bias. Which I agree, and we didn't talk about it. There are all kinds of statistical tests that one can do to address publication bias. The most important way to address publication bias, at least that is possible in systematic reviewing, is to try to prevent it by including studies that aren't published in journals. So all of the working papers in economics and political science and I agree that there's potentially a problem of, I don't know what we would call it, evaluation bias. Mm-hmm. Only the interventions that get evaluated are the ones that are more likely to work. But as you can see in the case of Banerjee, of that one particular case in Rajasthan, that isn't always the case. People are still trying to test interventions more generally. On the time period, I think it's a difficult question for me to answer, but I agree that Rahul's talked about some of the possible biases in studies actually making it into the interventions that actually make it into the evaluation literature, and then we have this problem of, well, how long does it actually take to build up the capacity or the acceptability for governance, the institutions to actually change, and that's a very slow process. So I think rather than saying that it isn't important, what I'm saying is that it may be important, but also what we think is important, that perhaps, for some of these interventions that really just are very citizen-oriented, that so perhaps some of those are those interventions actually targeting there are two issues. The first one is whether the interventions are actually targeting the problem, are actually solving the problem, or are actually likely to solve that problem. And this goes back to the Rajasthan Police force case. The second question is, well, could we actually achieve improvements over a shorter time period by implementing more cohesive interventions which don't just try to engage citizens, but which
have a supply side component.
Either have a supply side component or by operating in the compact between the, somehow improving incentives within the service delivery organisation itself. So I think that's what we're kind of concluding with this review, basically, that it might be one of those, basically, and we did specifically want to just look at citizen engagement and see to what extent is citizen engagement in and of itself likely to be effective.
Yeah. Like I said, they've picked a narrow thing, but they've gone, they tried to take a broad approach to answering that narrow thing. The narrow thing is citizen accountability, and within that, then can you be broad about not particular things that target, but mechanisms with which citizen accountability sort of operate.
Yeah.
And that's interesting.
So the SDGs is I'm not a governance expert, but the SDG is certainly not the starting point for I think the movement to decentralise.
It's been a long time.
Since the 70s.
If anything, I would say we're on the tail end of, right? Like at one point, I think maybe 10 odd so years ago, this was much bigger, right? Like there was much more noise around it. Lots of people were trying it. So that was at the peak, right? And now I think is sort of the reality check time, right? Like how much potential do these things actually have? And they're finding out that there are limitations to this approach, that it needs to be complemented with other things. So I would say that it's actually on the sort of stable period, right? Like where now you're more likely to know what's like these guys have given you evidence on it's more likely to work if you have a frontline employee on the other side, and then you can adjust service delivery a little bit. At one point, there was citizen accountability for everything. It was just touted as a silver bullet, right? Like this is what will make governance happen. And quite clearly, it was tried in a lot of places, and it didn't make governance happen. So now we're in the it can deliver something somewhere under some conditions, and we're getting better, I think, at knowing what those conditions are.
Probably the reason why there's a lot of discussion about it at the moment, other than the SDGs, is the World Development Report, I would think. The World Bank World Development Report from 2017.
Which, interestingly, in 2004 was one of the places where the short route terminology, I think, comes from there.
Okay, so Nita's question on community-driven development. Yes, there's a lot of similarities between this. Part of the reason why we were able to do this study is because of the work we've done on community-driven development, and certainly if you, when we eventually publish a report from this, you would see that the way that we've conceptualized the supply and the demand side and the results chain is very similar to that study. And I think that, and certainly, what else is similar when this notion that there is what Howard White calls a funnel of attrition, that as you go along a results chain, you would generally expect to see smaller and smaller effects. And you would particularly expect that to be the case if an intervention doesn't address both demand and supply side, or it doesn't address all of the factors which inhibit people using services, or doesn't address all of the factors which cause poverty, which what intervention does. Then you would expect to see smaller impacts. So I think it's quite consistent with that study as well. Yes, there has. I mean, I don't know. There is a movement towards. There has been a movement since I think the 1990s towards trying to decentralize service provision, involve citizens. I do not know what the evidence is on the effectiveness of that because I'm not aware of, there may be systematic reviews out there, but I'm not aware of them.
I think the interesting thing is citizens are quite often characterized as less engaged in the developed world than in the developing world. Voting percentages, for instance, are one statistic that's often touted, right? Like, mostly in the developed world, fewer people turn out to vote than do in the developing world.
Yeah, that's one aspect.
It's one aspect, certainly.
Okay, any other questions? Okay, so yeah, just a couple of thoughts to take us out. So the question this review was addressing was do participation and accountability improve development outcomes? It sounds like a yes or no question, but I think we all would have known going in that it's not going to have a simple yes or no answer. But what the Hugh and the other authors have done, have kind of proposed one framework for kind of breaking it down into smaller questions that maybe we can get something closer to yes or no answers. And I think that's valuable, and I think it's a fruitful area for future research, exploring other frameworks or other ways of kind of looking at the question. And I think the point about these demand-side focused interventions, not showing a whole lot of effect, and the importance of attacking the problem on multiple fronts and complementing demand-side interventions with supply-side ones is a very important point. I think pretty policy relevant as well. So that's what I have. Thank you all very much for coming, and we hope to see you again at the next Delhi seminar series.
Thank you.